Good morning, Maryland. I'm Christian Schaffer. Thanks so much for joining us for this special Facebook Live discussion. This morning we're talking about coronavirus, and I'm joined by two experts from GBMC. Dr. Ted Bailey is the chief of the Division of Infectious Diseases at GBMC, and Molly Hyde works with infection control at the hospital. You guys, thanks so much for joining us this morning. It's an important discussion, and it's something that everybody's talking about, coronavirus. It's on the news. People are talking about it amongst themselves, they're talking about it at church groups, schools. It affects pretty much everybody. So let's just get some of the basics out of the way first. What is the coronavirus as compared to other viruses that we're more familiar with, the flu and the common cold?
Go ahead. So coronavirus is a family of viruses. So coronaviruses are a family of viruses. COVID-19, the one that we're kind of dealing with in this outbreak, is the disease that is caused by one particular virus in that family. And that virus is called SARS-CoV-2. So there's a little bit of a difference between COVID, which is the disease, and SARS-CoV-2, which is the actual virus. The other members of that family are things like SARS and MERS, which we all kind of know about from the recent outbreaks of those, but then also viruses that cause the common cold. So you could have been infected with a coronavirus and it just caused the common cold. So this particular outbreak is due to a coronavirus, but it's not the only one.
And I've heard people call it novel. I assume that means new. In other words, we've not seen something exactly like this before. Is that about right?
That is correct. It's a new member of that family of viruses.
Mm-hmm. And it started in China.
Yes.
That's where the initial outbreak of patients were exhibiting respiratory symptoms. But unfortunately, in some cases, they've been serious and they haven't been able, or treatment hasn't been effective for some of these patients.
That's right. And that's not uniquely true for this novel coronavirus. There are other viruses for which some fraction of the illnesses end up being severe and even fatal. That's true particularly of flu, for instance. But in this case, there were novel pneumonias that weren't explained by existing organisms, either bacteria or viral, and then that led to the discovery of the novel coronavirus.
And so when we hear a word like pneumonia, it sounds a little more serious than the flu, potentially. Although I guess you can't have a serious flu case, but if you get pneumonia, now you could require hospitalization. And you're saying that this particular type of virus in some patients has led to an actual form of pneumonia in the patients.
And to help with terminology, because in moments like this, the terminology just comes out of the woodwork.
Yeah.
Pneumonia would mean an infection of the lower part of the airway, what we call the lungs in medicine. But anything can cause that. So it can be a bacterial pneumonia, but it can be a viral pneumonia. And in the case of flu, one of the things that distinguishes flu and the coronavirus from things like the common cold is that it does settle down into the lower airways, into the lungs, and that's part of why it's so severe.
So talk about how quickly or how easily it spreads, and especially with regard to your work in the hospital trying to prevent it from spreading in a place where people already may be sick or have other infections.
Sure. I mean, we're still trying to work out how quickly and how easily it spreads. It's believed that it's spread by respiratory droplets. So that's going to be when you cough or you sneeze, respiratory droplets come out of your mouth and nose, and that can spread the virus. It's generally spread by prolonged close contact with somebody who has the disease. It can also be spread by surfaces. We call those fomites in public health. And these are just inanimate objects that can hold onto that virus and can transmit from person to person. So think of a doorknob, for example, is a fomite. So in the hospital setting, you know, we of course have our healthcare professionals wearing the appropriate protective equipment. We also have cleaning procedures in place. Fortunately, this virus is very easily killed on surfaces by common disinfectants. So we are able to clean surfaces and get rid of the viruses like that.
Is there, it being new, some of these questions that people have legitimately are difficult to answer, and sometimes you hear different answers to them, and I think one of the reasons is that it's new. But my question is, do we know how long it can survive on a surface like that? Or is that not really known yet?
It's not really known for this specific virus. We know for things like SARS and MERS, which are also in the coronavirus family, like I just mentioned, they can live for several days on surfaces, but it really is highly dependent on temperature and humidity. And so depending on the environmental factors, it may live for less time than that.
So in the hospital, you're taking precautions, and I imagine that similar precautions, including regular old cleaning at your home might be a good idea.
Yes, absolutely. Not only regular cleaning, but hand hygiene. That is also critically important. So that would be either washing your hands with soap and water or using an alcohol-based hand rub. So that really is critically important, not just for coronavirus, but honestly, if you don't want to get the flu, if you don't want to get a cold, that is really your best method of protection. In terms of cleaning in your home, just a regular standard disinfectant is effective in killing the coronavirus. So if you are worried about surfaces in your home, just make sure you're reading the label and you're using it correctly, because different disinfectants have different instructions for use.
So people in the state of Maryland, I believe the number as of this morning was 9 that have been positively diagnosed with this new virus. How would a lab or a doctor diagnose that as compared to something else like the flu? Like, it's clearly different, but that determination must be made as quickly as possible. How does that work?
So the first part of it, and this goes to what's new and what's not new about the new virus. The fact that it's a respiratory virus, the fact that we've had a lot of experience with encountering patients with these symptoms has led to well-established ways to examine and evaluate symptoms. What we're looking for are the characteristic symptoms of the virus, and those have tended to be fever is a very common feature of it. A cough, which tends to be dry, also fatigue, aches. In a few cases, maybe about 10%, there's also been gastrointestinal symptoms, diarrhea, upset stomach. So we ask about those symptoms. We would also ask about relevant exposure. Have you been around someone who's sick? Just to kind of get the idea if this is somewhere that we should be suspicious. Does it have the symptoms that fit? Those symptoms are not unique to the coronavirus, but once you're in that ballpark, once you're thinking this is something that could be corona, testing has developed. And this is one of the real advances between this outbreak and the SARS outbreak in 2003, is that we've been able to identify the virus much sooner and really roll out diagnostic tests. Now, could they be rolled out faster? Yes and no. I mean, they've been rolled out at various speeds in different countries. And at this point, not only does the CDC have it, not only do state public healths have it, but also private laboratories have it and have been able to make it available. And that's been changing from week to week.
And people are used to going to places like that now in 2020. You go to your doctor, but you also go to the Quest or the LabCorp. And if you were to do that, if there was some suspicion that you might have a virus, even whether it's corona or the flu, what does the test, what would it look like? Are we talking about a nasal swab, or is it a blood test, or how does that work?
So it is a swab, and so it's not a blood test or anything like that. You're taking a sample directly as a swab, and it gets sent off to the lab. Now, as I said, there's a variety of tests that have been brought out, and these are new tests. These are not, we're not using the flu test or these other pre-existing tests. We have to test for this particular virus. And as a result, the quality and the characteristics of these tests are not fully defined yet. It's hard to just compare one product to another yet in terms of its accuracy. Mm-hmm. And that's something that we'll learn over time.
Yeah, that's something that's being learned as this is happening, I guess. I have a question that came in from Tiffany, who's watching. Is concerned about that issue with the cleaning, because people, you want to do it. She says she's got a 2-year-old son who's probably getting into everything, and she's wondering what might be the best, products to use for something like this. Can a more mild disinfectant be effective in cleaning your home in this way?
So you really want to use something that is effective against a type of virus called enveloped viruses. So these are viruses that have a lipid bilayer around them, and if you can disrupt that lipid bilayer, you can essentially kill the virus. So flu is one of those types of viruses, so I would recommend, if your disinfectant says that it's effective against the flu, it should be effective against coronavirus as well, because flu is similar in structure to the coronavirus.
I was just going to say, they might not have that on the label, given how new it is, but flu, they would have that.
Yes.
Yeah, so you could
so
look for
really
something like
check the label for what it says that it is able to kill.
And if something works for the flu, it's very likely to kill this virus as well. Correct. If it was to happen to get onto a surface in your home. Stacy is wondering about this issue with comparing it to the flu. In flu season, it does tend to spike and then it goes back down again. Is it possible or likely that the coronavirus is going to do that as well, or do we know yet?
Well, obviously we don't know in the matter of certainty, but we can take a look at history. We have the first SARS outbreak in 2003, another severe coronavirus, and that one came up in the fall and continued on until the summer, and then it petered out. So we did see some seasonality to that, but there's nothing that we should expect, or we should prepare for the worst and be surprised with the best. The flu also has that seasonality, but we wouldn't know why that would be, and I think we should prepare for this to go on longer, because it has a lot of momentum at this point. Mm-hmm.
So the best thing to do is just to prepare with these types of precautions for as long as it takes, and not just assume it's going to be gone a week from now, basically. And that kind of leads me to another question that has been on the news and somewhat potentially controversial from time to time, but it's affecting a lot of people, is this issue with cruise ships. It seems to be on the one, there was one in Japan, there was one off the coast of California. And some people have thought or heard that maybe this virus doesn't do as well in hotter climates. So they think, well, maybe I can go ahead and take my cruise. I'm going to the Caribbean. They're not sure what to do with issues like that and just potentially travel in general. Do we know that about the coronavirus, that it actually doesn't do as well in warm weather? Or is that just something that people are kind of speculating at this early stage?
I mean, that's something that people are speculating at this early stage. That's not something that's known, factually.
Right.
In terms of cruise ships, I think the reason that, it's really rapidly spreading on these cruise ships is just think about the environment of a cruise ship. You've got a ton of people, they're all packed together. There's lots of common events where everyone is coming together on a cruise ship. So, just reasonably, it makes sense that you would see it spreading quickly on cruise ships. But in terms of warmer weather versus colder weather, it's not really known yet whether warmer weather is going to make this virus go away.
And it's not just cruise ships. There's been recommendations to try to, if you can, avoid gatherings where there's lots of people.
Yep.
I assume that goes together with that.
Yes.
But I would say those gatherings tend not to be several days long.
Yeah.
So, one of the things that would distinguish a cruise ship from the Super Bowl, if we were still back in that season, would be that the Super Bowl is a one-day-off thing, whereas the cruise ship, you're in this setting for multiple days. And one of the things that I think feeds into it is that the coronavirus can be without symptoms for a period of time. In fact, a number of individuals will have no symptoms at all and may still be able to shed it. So somebody may go onto the cruise ship, may not have had any symptoms at all, may not even have symptoms for several days and not show any signs until well into the cruise. So that's a possibility. So you couldn't even screen for symptoms at the onset. I mean, you could do it and you would eliminate those people, but you wouldn't be guaranteeing that no one gets on it without it. And then the other part of it that's different than flu, it seems, is that it's contagious over a longer period of time. People with the flu tend to be contagious for about a week, but it seems that you may be able to shed the virus, if you're infected with it, the coronavirus, for maybe 2 weeks, maybe even a little bit longer than that.
And some people are more concerned about it than others. Let's just say that right now. Some people, though, who are less concerned about it will say things like, well, we have seen most people who get it do actually recover. There have been deaths in other countries more so. There's been a few here, but there are some people who recover. What's that process look like for somebody who actually contracts the actual coronavirus but winds up recovering? How did they do that?
Well, everyone is a little bit different in terms of the constitution of their immune system and in terms of the vulnerability of their various parts, their various organs. And one of the things that we've learned is that when we look at who's dying from coronavirus, it's not evenly distributed. There are certainly identifiable high-risk groups. Age is one of the most important variables here. In folks who are 80 years and older, we see a much higher death rate among the cases. Even if you're 70 to 80, not quite as high as above 80, but you still see a higher death rate than someone who's under 50. And then children themselves seem to be the most mildly hit by it. We do see flu deaths among children, but we see much milder versions of coronavirus among children. So age is one part. And then chronic disease is another variable that we've found, that people who go into the infection with chronic heart disease or chronic lung disease, so-called COPD or asthma, or maybe they have cancer, or maybe they have diabetes. Any one of those groups has a much greater risk of death from the infection than the general population.
Katie's got the toughest question of all for you guys that you're going to get today, I suspect. But it is a big issue because a lot of the schools here in our area have spring break next week. So we're talking 4 days from now, people have trips planned. Katie says, I've got a family trip planned to Florida in a few weeks. Should I postpone the trip? That's got to be a tough question to answer. But Katie, we're going to try to do our best for you here right now. What do you guys think about that? Would you cancel a trip if you had something planned?
Does it involve cruising down to
I
Florida?
mean, a lot is going to
we're on a boat.
depend. Yeah, a lot is going to depend too on the family that's going. So she said her family is going. Does that include elderly parents or grandparents? It's not recommended for people in this higher risk age group to do much traveling. CDC recommends for that group to avoid non-essential air travel. So, if her trip is with elderly parents, that would be a reason to maybe postpone. If it's just her and her family, young children, it's really difficult to say because it's really hard to predict exactly what's going to happen even next week.
That's what's been so interesting about the development of this virus. We had stories in the news back in December about this issue in China, and nobody had heard of the city of Wuhan until at least I hadn't. And then now you get more and more, whereas recently, in the past recent weeks, we start to hear this much more serious issue where it's here, and we know people in this state have it, and the governor's giving news conferences every day. So there has seemed to be a ramping up. And so for people who have something coming up in a week or a few weeks, you got to wonder what's it going to be like then by the time it's trying to go. I think that's the concern some people might have.
So I mentioned, are they going on a cruise, but it does matter how they're traveling.
Yeah.
So you had mentioned planes. There's the old-fashioned car travel, the car trip. And in that case, you're in a setting with people that you're already exposed to in some cases. And you'd be traveling from one state that has probably identifiable cases of the coronavirus into another state that has identifiable cases of the coronavirus. So if you decide to stay put, you would be staying put in a state that already has identifiable coronavirus. So the attributable risk of being in one state rather than another state is not defined. And it would be changing from week to week. And I would also say it depends on what you're going to do there.
Yeah.
Are you going to be out by yourself in the wilderness, just checking out the wilderness, or are you going to go to a party? Are you going to be going to some large social gathering?
A ski lodge with lots of people in it.
Right.
That's very different than just going out, with 2 or 3 members of your family out on hikes.
Yeah. The issue, the airlines have got to be concerned about this, and I've heard them come on TV and say how clean the airplanes are, and the air in an airplane gets filtered, and they're obviously going to say that, but still you are put on there with other people that you can't get away from for a certain amount of hours, not to mention the airport itself has a lot of people gathered together. Would you say you might, this is difficult to answer, have less chance of getting a virus like this just by driving somewhere than by going through with the plane trip?
Certainly. I mean, as Dr. Bailey pointed out, when you're driving somewhere, you're in a car with just the people you're exposed to anyways versus all of these strangers that you wouldn't be exposed to in your normal life. Keep in mind, too, on an airplane, your risk of contracting coronavirus or really any other respiratory virus is going to be really directly proportional to how close you are sitting to somebody who is ill. So if you're on one side of the plane and somebody with coronavirus or the flu is completely on the opposite side of the plane, those respiratory droplets aren't going to make it to you. But if the person in the seat right next to you is, coughing all over you and they have the flu or coronavirus, you're much more likely to be infected. That really increases your risk of exposure.
So if you find yourself on a plane where you do hear somebody coughing these days, I mean, you don't want to be mean to the people, but would it be possible to change? If you're saying if you're further away from that person, you have a better chance of not getting it.
That's correct.
Yeah, that's very interesting.
But that's not new this year.
Yeah.
So if you were to go back to flu seasons
Right.
every other year, that's when people were traveling around the holidays. That's always been an issue. So everything that the airplanes and airlines are saying about the relative safety, you have to sort of take that in consideration along with the experience that people have acquired flu in traveling in the past.
Do you know, or is it too early to say yet, if people get it once? Melinda's wondering, and thanks for the question, by the way. If it's something where you get it once, can you get it again, or do we know that yet?
We don't know that yet. It's possible. It's certainly possible. It's something that you will develop long-lasting immunity to, but we don't really know how long that immunity will last. Is that a lifetime? Is it a couple months? We don't really know at this point.
What about for the other ones, the SARS and the other earlier similar ones? Do people become immune to that, or do they wind up?
The SARS is almost hard to say because clearly most of the world wasn't
Versions
exposed
of
to
it.
it and yet never had it.
Yeah.
And so it's not clear that the reason why it petered out was really due to the development of immunity.
Right. What about, are you in agreement with what we've heard from people at the CDC and the federal government that it could take quite a while to get some kind of a vaccine or an actual treatment for this? I mean, I've heard a year or more potentially.
Yes.
Does that sound about right?
Yes.
Yeah.
You have to think with vaccines. I know there have been a lot of, a couple months they'll be ready with vaccines. In a couple of months, they will be ready for large-scale production of vaccines that then can go to clinical trial. So you can't just manufacture a vaccine and then start injecting it into people. There are certain clinical trials that you have to go through before you can actually start distributing it to the public. So there's a phase 1 clinical trial, which is a safety trial, and then a phase 2 clinical trial, which is an efficacy trial. So we have to make sure it's safe, we have to make sure it works. At that point, you can then start vaccinating the general public. So realistically, it will be a year to 18 months.
Right.
At that point, if the study's successful.
Right, exactly.
So, it's important.
not
It's
be.
important. The reason why you do the study is to see if it in fact works. And we would not be able to anticipate. There's been desire to have a vaccine for HIV, for instance, and there is not yet one, and there's tremendous need for it. So the ability to design a vaccine in real time for a particular virus is always up in the air, whether it will.
As much as people would love to say, look, we can flick a switch and make it happen,
Right.
it's just not how it works
Right.
in the development of that. You kind of answered this one already. Caitlin, though, is wondering, really, things like the disinfecting wipes and sprays like that, those are effective in your home for getting rid of this virus if you're concerned.
Yep, that is correct. Those, and also I want to mention again hand hygiene. I mean, really don't just say, oh, well, I sprayed my countertops with this disinfectant, so I'm fine. Really, hand hygiene is going to be your best course of action to prevent this coronavirus and really any other respiratory illness that you might be exposed to. Nobody wants to get the flu. Nobody even wants to get a cold. So really, your best bet is to wash your hands. When you walk in the door from work, when you bring your kids home from daycare, walk straight to your sink and wash your hands. That is really the best thing you can do. And really make sure that you're doing it properly as well. Follow CDC guidelines for the proper way to wash your hands.
Joined by Molly Hyde, who is an infection control practitioner at GBMC, along with Dr. Ted Bailey, who's the chief of the Division of Infectious Diseases at GBMC, for this Facebook Live discussion. A lot of questions. Thanks so much for all your questions. Thanks so much for you guys for coming in. One of the frightening scenarios that you see if you look at some of the things that have come out of China and now places like Italy does deal with healthcare workers. If you've seen some of the news and how difficult it is for what they're dealing with in places like northern Italy, have you heard that concern from people at GBMC, and are you feeling comfortable with the steps that you're taking to prevent actual healthcare workers who have to deal with these patients from contracting the virus themselves?
Yes, absolutely. And absolutely people are concerned. And it's not wrong to be concerned about your health when there's something new that we don't, know a lot about. The fortunate thing is that although this particular virus is new, respiratory viruses are not new. Outbreaks of respiratory viruses are not new. We know how to control respiratory viruses. We know what types of protective gear that healthcare members need to wear to prevent their exposure. So I am confident that we are protecting healthcare workers at GBMC. We collaborate with the state for any patients who come in who we believe have a suspicion of being a COVID-19 patient. We use the proper PPE for everyone. And then, of course, hand hygiene is really the number one thing that our staff members do.
I have to assume that with this going on, that's being communicated constantly to the people at the facility.
Well, so we carried out town halls this week.
Yeah.
We gave one in the morning, one in the evening, so the different shifts could see them. So we've been communicating that, and there's frequent emails updating because it is something that's being updated constantly.
Right.
We have a permanent website that our employees can access. So it has been obviously a concern. And one of the things that drives it as a concern is the quality and the nature of the exposure of a healthcare worker to a patient or to someone who might have this virus. The nature of that contact is often quite different than just the casual contact. So there's sometimes a sort of aura of hypocrisy. And you're like, well, they're using these masks and they're using these devices and they're suggesting maybe we shouldn't use them. And the reality is that there's a very close contact to examine someone's throat, to examine someone's tonsils, to be around someone as you're examining, maybe even doing procedures where you're sampling the airway. These are things that generate an even higher exposure to the droplets that we've been talking about. So in those settings, we do, in all honesty, we use these respirator masks. And there's concern about the scarcity of them. They've been bought up. And they've been bought up sometimes to be used in settings where that level of exposure is not
Right.
present. But we do use them, but that doesn't necessarily generalize that level of risk is representative of what you would have out in the community.
Right. The thing, people, about a week or so ago, the story changed. It moved so quickly, but there was this concern that people should I be wearing a mask as I walk around in my daily life? And the answer was, well, that's not really how you get it. It was from touching things and touching your face. That seems to be still the case, right? Like, we're not encouraging people to use masks in their daily life.
That is correct. Masks haven't been shown to prevent spread among the general public of coronavirus. You can get it by, direct inhalation. It's not just touching things and touching your faces, but realistically, you need a prolonged close contact with someone who's coughing. So think if you're in the grocery store, if somebody is coughing, you're not just going to be standing right up there next to them. You're going to be moving away. So just passing someone in the grocery store, that is not prolonged close contact.
Yeah. And so, again, maybe the incremental benefit that a mask might have if in place at that particular moment, it seems to also be offset by the fact that these are technically difficult things to use correctly. And like any other safety device, say a seatbelt, if you don't buckle it correctly, it's not serving as a safety device. So the idea is if a mask is here, maybe it's blocking a droplet, but that droplet then is on the mask, and how you handle the mask and what you do with it is absolutely critical, how often you're changing it. So in a low-risk situation, then it's often offsetting any benefit from the mask, and that's what's led to them not being recommended generally.
Yes, exactly. I mean, you see a lot of people, they'll pull them down right below their nose, or they'll even pull them down under their chin to talk to somebody or eat something and then pull them right back up. Well, I mean, like Dr. Bailey said, that droplet is on that mask, so now you're pulling it down right underneath your nose and mouth where you could just be breathing it in. In addition, now your hand is contaminated, and it can give people a false sense of security. Oh, I'm wearing my mask, now I don't need to wash my hands.
Oh, yeah. And actually, one more key detail that I would point out is that when we leave a room with a patient that's a high suspect, that equipment comes off.
Yeah.
So we're not walking the hallways of the hospital, among others, in this kind of a setting with this kind of equipment on. So this, again, just to address, I think sometimes that aura of hypocrisy, is understand exactly what we do with them. We're in there only when we're in a room, dealing with the patient. When we're back out amongst each other and still in a congregated setting in a hospital, we're not wearing these things.
Some people just have a hard time, I think, believing how much, because it's time consuming, and a lot goes into those practices, which you have to follow in that setting, because you don't want to pick up these viruses and be missing work when we need you the most.
Exactly.
Yeah. So here's a key question. Matt's asking it. A couple other ones on here. I believe Caitlin. What do? You think maybe you have it. Maybe you're coughing. Maybe you have a little fever. What do you do in that situation? Because everybody's heard of this now.
Sure.
And so that's the first thing they're going to start thinking is, oh my gosh, do I have the coronavirus? What's the best course of action?
Well, the first part is to remind ourselves that, in fact, like the flu, most of these cases, the very vast majority of them are mild. And so if the symptoms remain mild, then that's where you're headed. That's where things are headed. And so and again, we haven't talked about this yet. We talked about the fact that there's no vaccine. There's actually no treatment for it in the sense of a medication that cures the virus.
Right.
So accessing a healthcare system, getting into your car right away at the first onset of mild symptoms to say, well, I've got to get a treatment for this. There's no treatment to be had. And in fact, in most cases, no treatment would be needed even if there was one. So realizing there's no benefit to going out with mild symptoms is the first, I think, mental check. If you start to develop symptoms this is worse from day to day, and the real symptoms that are concerning are the development of shortness of breath, difficulty breathing. That starts to suggest that you may be tracking in the direction of a more severe one, and contacting your healthcare provider would be the first step, your primary care doctor.
And would I be of heightened concern had I just traveled someplace that may have had it? There's been people coming home and self-quarantining, they say. Could that be a consideration if, like, I was in Italy, now I've got a little bit of a cough? I think I'd be a little more concerned.
Well, there's two elements of concern. The concern is, do I have the coronavirus?
Yeah.
And there's a secondary concern is, even if I have it, is this anything of medical severity or concern?
Right.
So you don't want to spread the non-coronaviruses either. So if you've got a respiratory illness, you've got fevers or aches or a dry cough, these are the kind of things that should lead you to withdraw somewhat anyway. We call social distancing. And use your elbow to cough. Be mindful. Use what we call respiratory hygiene. But they're not the things, again, that require access to a healthcare provider.
A lot of people just run to the ER when they start to have symptoms of any kind, especially if they're of heightened concern.
Right.
And you're saying that is probably not the best course of action right now.
No, you really don't want to just go rushing into the ER for just, a cold. A good rule of thumb to use is, would I go to the ER for this if there was no coronavirus outbreak going on right now? If the answer is yes, if you require immediate medical care, you are having an actual medical emergency, then absolutely you need to go to the ER. If the answer is no, if you never would have even thought to go to the ER for the level of illness that you have, then you want to stay at home. You isolate yourself from your family members. You know, if you are feeling okay and you're okay to take care of yourself, you don't need anyone providing care for you. Go into your bedroom, shut the door, and give your primary care provider a call. Call them first, and they can often advise you on the phone as to whether or not you even need to come in based on your symptoms.
So one of the issues with knowing as much as we can know about this is that there is privacy. As far as people who, if they have it, we're not going to go on the news and say what their name is, unless they come forward and want to talk about it. But what we do know some things about at least the 9 patients in Maryland, including the most recent one in Montgomery County, who they've said is in good condition and at home. That person who has been confirmed to have this, according to the governor and the state, is not at the hospital. She's at her home under self-quarantine, which from what you guys are saying sounds appropriate in her case.
Absolutely.
Yeah, so it's not necessarily if you get this, you're going to be at the hospital being treated for several weeks. It depends on how it goes. Yeah, that's interesting. There is so much information out there about this, both in the impact of it that's on the news. Today you're going to see some of our local colleges are sending the students home. How do you guys recommend that people kind of sort fact from fiction and remain calm but vigilant in this situation?
Yeah, you really want to use reliable public health resources to get your information. So the Maryland Department of Health has set up a 211 hotline. If you've got questions, you can call. You can go on their website and see if they have frequently asked questions there. You can see if your question has already been answered. And then CDC has some wonderful resources as well. But you really don't want to believe everything you hear or everything you read, because there's a lot of misinformation out there.
Yeah, and people are a little bit concerned, and so sometimes they tend to believe things that may not be exactly true. So yeah, the 211 is the number that the state has set up. If you have questions or concerns about it, that's one thing. And once again, Dr. Ted Bailey from the Division of Infectious Disease at GBMC, and Molly Hyde from the Infection Control Practitioner at GBMC. We really are so appreciative of you guys coming in and talking to us today. I'd shake your hand, but I'm not sure if we're supposed to be doing that anymore these days. We'll bump elbows when this is over. But thanks again so much. And people do sometimes tend to submit questions after these are over. If they do, we'll forward those to you and try to get those back. And the actual interview itself goes up permanently on the WMAR 2 News Facebook page if you want to watch any portion of that again. But once again, thanks so much to both of you for coming in, and good luck
Thank you.
with what may be coming to the hospital. We'll see. Thanks again. Thanks for watching this special Facebook Live discussion on the WMAR 2 News Facebook page.